I think this is a really important thing to dive into. So blood testing for adrenals. So Evan highlighted this a little bit already. So blood testing is very helpful on the adrenal side to look at pathological levels. So if we look at like an AM cortisol serum, if we see it very high, that could tell us there could be some definite adrenal excitability. Now, high levels of cortisol is Cushing's, right? We remember that because Cush, we think push, right? Cushing's, we're pushing cortisol really high. Cushing, we're pushing cortisol really high. So if we see high levels of cortisol on a blood test, it's, or in the top 20, 25%, we're thinking, okay, there could be a problem with that, right? Why don't I like that? Because people by nature don't like getting pricked with needles. Okay. So some people just going to the doctor's office, they could get a lot of cortisol and adrenaline going in their body because of that needle prick. And then that's going to cause a false high reading. So I don't like it because you can get a lot of false high readings. Number two is I do a lot of the Dutch testing. I like the Dutch testing because I can look at cortisol serum total via the urine. Now, I like it for two reasons. One, it's not a big stressful thing to collect that, right? It's not a needle prick, so you're not creating a lot of stress during the extraction process. Number two, we can collect that total cortisol throughout the whole day. So we're not just looking at cortisol as a snapshot in time. We can collect the cortisol throughout the whole day, which gives us a better window of your overall cortisol output for 20 hours. So if we see higher levels of cortisol over 24 hours, we know that this probably isn't a blip thing. This is probably a stronger pattern of adrenal dysfunction when we see that. And that test can also separate the free cortisol out, which is what Evan highlighted earlier. That's the more bioavailable cortisol. So think of free cortisol. 2 to 5% of cortisol is free. This is the cortisol that's not bound to a protein. Think of that as if you're a woman and you have your purse, right? And you have a key in your hand and you're putting that key in the lock, right? The key in your hand, that's the free cortisol, right? It can work. It can go into the lock. Think of the other 20 keys in your purse or your back pocket if you're a guy, right? I remember like back in school, there were these janitors that walk around with these keychains that were just like huge, right? Like massive keychains. So imagine the key in the hands, the free cortisol, the key in the back pocket or the purse, it's the total cortisol or the serum-based cortisol, meaning you have it, you're carrying it around, but you can't quite use it to open the door. Does that make sense?
Yes, it does.
Okay, so that's another Rolodex analogy on the cortisol side. So we can swap one today, all right? We can swap one. So in general, cortisol can be an issue and we have to know the right way to test it. So blood testing, really good on the pathological side. I'll have a lot of people that just come in with these data already. And if I see someone in the top 25%, I'm like, ooh, could be a problem, right? Or someone in the bottom 25%, I think, ooh, could be a problem. We'll still do further testing, but there's a lot of data that comes in. So we have to know how to interpret it either way.